Welcome to Lesson 21, the endocrine system. In this lesson, we'll examine the body's hormone-producing glands, key endocrine disorders like diabetes, the effects of aging, medication classes, and the QMA's responsibility in endocrine care. By the end of this lesson, you will understand how hormones control many body functions, how disorders like diabetes are managed, and how to safely support residents with endocrine conditions. The endocrine system consists of glands that produce and release hormones. These chemical messengers influence nearly every bodily function, from mood and growth to metabolism and sleep. Each gland in the endocrine system has specific roles. For example, the pancreas controls blood sugar, while the adrenal glands manage stress hormones like cortisol and adrenaline. The thyroid influences metabolism, and the pituitary coordinates many other glands. Diabetes occurs when the pancreas fails to produce insulin or the body can't use it effectively. Symptoms include frequent urination, extreme thirst and hunger, and fatigue. Type 1 requires insulin. Type 2 may be managed with diet, pills, or insulin. Recognizing hypo and hyperglycemia quickly is critical. Hypoglycemia presents with shakiness and confusion, while hyperglycemia causes fruity breath and deep breathing. Untreated, both can be considered life-threatening. Proper glucose monitoring helps prevent complications. Diet and exercise are key to managing diabetes. Insulin must be administered correctly according to timing and type, short-acting before meals, long-acting for control. QMAs play a major role in observing diabetic residents. Monitor meal completion, skin and foot conditions, and ensure proper hydration. Report abnormal glucose levels or symptoms to the nurse immediately. Other endocrine disorders include hypothyroidism, which slows the body down, hyperthyroidism, which speeds it up, hyperinsulinism, causes dangerously low blood sugars and requires dietary support. Hormone levels drop with age. This increases risk for diabetes, slows metabolism, and causes physical and emotional changes like menopause in women or lower libido in men. Medications include insulin and oral agents for diabetes, thyroid replacements for hypothyroidism, GLP-1s are newer injections like Ozempic, and hormone therapy for menopause or low testosterone. QMAs must watch for side effects and report concerns to the nurses immediately. And again, look in your textbook. This just briefly goes over the medication. The PowerPoints are very brief, so just make sure you're reading everything in the text. In summary, the endocrine system influences metabolism, growth, and many other functions. Diabetes is one of the most common and serious disorders. QMAs must monitor symptoms and medication use and report any abnormalities promptly. Please also be aware some drugs affect glucose. Some meds can raise your blood sugar, like steroids and caffeine, and others lower your blood sugar, like alcohol and sulfa drugs. Thank you.